Our lungs are the silent workers of our bodies, tirelessly fueling every cell with oxygen and expelling carbon dioxide with each breath we take. Yet, we often overlook their health until problems arise. Maintaining strong lung function is crucial for overall well-being. But how do you know if your lungs are struggling? There are warning signs our bodies give us when our lungs are weaker than they should be. Recognizing these signals early can make all the difference, prompting you to take action before small issues become serious health threats. Here are 10 warning signs of weak lungs that you should never ignore. First, persistent cough is one of the most common and easily overlooked signs of weak lungs. While a cough can result from a cold or allergies, if it lingers for weeks without improvement, it may be your lungs struggling to clear irritants or infection. Chronic coughing can indicate underlying conditions such as chronic bronchitis, asthma, or even early stages of chronic obstructive pulmonary disease, also known as COPD. If you find yourself reaching for cough drops or suppressants more often than usual, pay attention. Your lungs may be trying to tell you something. Second, shortness of breath, especially during activities that once felt easy, can signal reduced lung capacity. You might notice that climbing stairs, walking short distances, or even carrying groceries leaves you unusually winded. This shortness of breath, known medically as dyspnea, suggests that your lungs are not efficiently absorbing oxygen or expelling carbon dioxide. It could be due to inflammation, airway obstruction, or even early heart problems. If you find yourself gasping for air or avoiding activities because you're worried about getting out of breath, it's time to take a closer look at your lung health. Third, frequent respiratory infections are another key warning sign. If you're often suffering from colds, bronchitis, or pneumonia, it may indicate weakened lung defenses. Healthy lungs are equipped with tiny hair-like structures called cilia that help trap and expel germs and debris. When lung function is compromised, these defenses weaken, making you more susceptible to infections. Repeated respiratory illnesses not only signal weak lungs, but can also further damage lung tissue over time, creating a vicious cycle that's hard to break. Fourth, wheezing and noisy breathing are often clear indicators that something is wrong. Wheezing is a high-pitched, whistling sound when you breathe, often noticed during exhalation. It results from narrowed or inflamed airways, making it harder for air to pass through. This symptom is common in asthma, allergic reactions, or chronic lung diseases. If breathing becomes noisy, or you hear rattling, crackling, or bubbling sounds, your lungs are likely fighting an uphill battle to provide your body with the oxygen it needs. Fifth, chest pain or tightness should never be ignored. While chest discomfort can have many causes, if it is related to breathing or occurs while coughing or exerting yourself, it may point to lung issues. Inflammation, infection, or even blood clots in the lungs can cause this sensation. Some people describe it as a heavy or squeezing feeling, while others may feel a sharp pain. Either way, persistent chest pain warrants medical attention, as it could signal anything from pleurisy to a pulmonary embolism. Sixth, chronic fatigue and unexplained tiredness are often overlooked signs of weak lungs. When your lungs aren't working efficiently, your body has to work harder to get enough oxygen, leading to constant tiredness. You may find yourself struggling to stay awake during the day, feeling drained after minimal activity, or noticing that rest doesn't seem to help. This lack of energy can be a sign that your lungs, and by extension, your entire body, are running on low reserves. Seventh, producing excess mucus or phlegm is another warning sign. Mucus is a natural defense mechanism, but if you're constantly clearing your throat or coughing up sputum, it may indicate ongoing irritation or infection in your lungs. Chronic mucus production is a hallmark of diseases like chronic bronchitis, but it can also point to allergies, infections, or exposure to pollutants. Pay attention to any changes in the color, consistency, or amount of mucus, as this can provide clues about what's happening in your lungs. Eighth, unexplained weight loss can sometimes be traced back to weak or diseased lungs. When your body is fighting chronic lung problems, it burns more energy just to breathe. This increased energy demand, combined with a reduced appetite, often seen in people with respiratory illnesses, can lead to significant weight loss. If you're losing weight without trying, or if your clothes are fitting more loosely despite no change in diet or exercise, your lungs may be working overtime, and you should seek medical advice. Ninth, swelling in your ankles, feet, or legs may seem unrelated to your lungs, but it's a subtle sign of trouble. When lung function declines, it can strain your heart, especially the right side, which pumps blood to the lungs. Over time, this strain can cause fluid to build up in the lower parts of your body, a condition known as edema. If you notice persistent swelling, especially at the end of the day or after sitting for long periods, it could be a sign that your lungs and heart are struggling to keep up. 10th, bluish lips or fingertips, known as cyanosis, are an urgent sign that your lungs are not delivering enough oxygen to your blood. When oxygen levels fall, the skin and mucous membranes can take on a blue or gray tint, most noticeable in the lips, nail beds, or the tips of your fingers. This is a medical emergency and requires immediate attention, as it can indicate severe lung or heart problems. If you recognize any of these warning signs in yourself or someone you care about, don't ignore them. Early detection of lung problems can lead to better outcomes and more effective treatments. Simple lifestyle changes, like quitting smoking, avoiding air pollutants, staying active, and following a healthy diet, can go a long way toward protecting your lung health. Regular checkups with your healthcare provider, especially if you have a history of lung problems or risk factors like smoking or exposure to toxins, are essential. Remember, your lungs are vital to every breath you take. Listening to your body and noticing these warning signs is the first step in safeguarding your respiratory health. Don't wait until your lungs are in crisis. Be proactive, stay informed, and give your lungs the care and attention they deserve.